Hey guys, Peter here from Team Sapiens PT. I've got another interesting low back pain case I wanted to share. So this was from a few months ago. Over the summer, it involves a high school diver. He was having some localized right-sided low back pain for a number of weeks. It seemed to be just getting worse. First came on, so he jumps right off of the diving board, and the more he jumps, the more his back hurts. So at a certain point, he was having to just sit off to the side and was not able to participate in his diving practice. I took him through a full lumbar exam. So what that entails is a range of motion screen, strength testing, neurological screen. So I wanted to orient you guys to what we're dealing with. If anyone's ever heard the term like L4, L5, what that's referring to is a specific location in the lumbar spine. So there's 5 lumbar vertebrae, and if we count up from the pelvis, you've got number 5, 4, 3, 2, and 1. So L, 5, 4, 3, 2, 1. Why that's important is because it can help us localize any deficits that might be present neurologically or otherwise. It's going to be hard to see here, so I'll give you guys a close-up. If I zoom the camera in here, you can see these yellow guys coming out in between the vertebrae, and those are nerves. So if there is an issue at a particular level, we can identify it through some testing that we do in the physical therapy exam. So each level corresponds pretty characteristically to a certain muscle action. So nerves have a motor function in that sense, and then also a sensory function. So each level corresponds to a certain field of sensation through, in the case of the lumbar spine, the leg. So I took him through a full neurological exam, checked all of his myotomes is what they're termed. That refers to the motor function of each level of the nerve at the lumbar spine. Totally fine for him. Nothing remarkable there. Took him through a full sensory screen, at least very superficially. Didn't show any deficits there. Wasn't reporting any numbness or tingling. Did a reflex exam. Again, that can test the function of the nerves. That all turned out fine. Next thing we look at is range of motion. As a diver, he's got to get into some pretty extreme positions. So from a flexion standpoint, could fold hands to the floor, no problem. Bending backwards, same thing. Sideways twisting, all of it was fine. So everything's looking fine at this point. His strength is fine, his range of motion is fine, his neurological function is fine. What's causing these symptoms? So I think this is the reason I'm sharing this with you guys is because as a physical therapist, our job is to investigate and problem solve, and I don't think a lot of people realize that. So one of the things that I'm looking for in any evaluation is the location of the symptoms, the location of the problem, or is that like a victim of sorts? So in this specific case, it seems like the low back is a victim. Now we have to start looking at other places to find what the cause of the symptoms are. Because his low back, from an exam standpoint, it moves well, it's strong, it's neurologically intact, there's no issues there. So where do we go from there? So, all right, he's a diver. The problem happens when he jumps. So I took him out to the gym, had him sprint up and down the track, no problem. Had him jump up and down on the track. So we have a strip of turf out in the gym that has some cushion to it. Had him jumping up and down on that. That was fine. Took him out onto like the concrete portion of the floor where we have our like tile floor. So it's a little bit stiffer and it doesn't give that cushioned effect that the track does. 2 legs he was fine, but after switching from 2 legs to 1 leg and having him jump up and down, he started developing that the right-sided low back pain that he's reporting. And after talking to him a little bit more, turns out he had an ankle fracture in recent history, maybe like a year earlier in the year. next thing I did was test his ability to push off of each leg. So had him stand just at a wall, stand on one leg. How many heel raises can you do? Did that on the left side, did that on the right side. So his right side could do about half as many as his left side, and the leg that he jumps off on the diving board is his right leg. So there you go, there's your answer. I sent him home with one exercise. Heel raises, but fast. Just on that right leg. Due to the nature of his activity, it's springy, it's a springboard. He's got to be able to create quick, high levels of force quickly and repetitively. I checked in with him, I think a week and a half later. Said he was feeling tons better, was participating in practice, which is great. So, things I want to highlight, again, recap. I think as a physical therapist, we provide a lot of value from a problem-solving perspective. And this case is a great example of sometimes how back pain isn't necessarily the fault of the back. Sometimes the back can be a victim. And we're equipped with the tools to kind of problem solve and reason and identify where that might be coming from. So I hope you guys found that interesting. If you like the video, subscribe, comment. If you have any questions, I'll leave my email in the description so you can reach out. Take care until next time.